Thank you, Shaun. Thank you, Chris. So we will now hear Shaun Cardiff about strategic leadership in person-centered healthcare.
Thank you, Claudia. I'll just wait until the...
Yeah. So I will just present Shaun. Shaun is a senior lecturer, researcher at Fontys University of Applied Sciences in the Netherlands. His teaching research field is person-centered practice and, in particular, healthcare leadership. Shaun's participatory action research doctoral study focused on person-centered leadership in the clinical setting. Thank you, Shaun.
Now I'm having... This is going to work. Yes, this is going to work. Thank you. I'm doing this title is Leadership in Person-Centered Healthcare, and to start off, I say really and truly I should ask Chris to hold an interview with Joanne at the moment, because that would just basically cover the presentation I'm about to give, but it would bring it more to life with concrete examples. But we can't do that because we didn't rehearse it. But what I would do is, for those of us that are not doing emails or behind their laptops doing anything else, to really think about what Joanne was saying and what Chris has been saying and what was said this morning as I talk about leadership in person-centered healthcare. Because I think if you think about what they've been saying, there will be lots of illustrations that I won't have time to give. We've seen this before today, and I presume everyone here is familiar with this framework. And it's a framework. It's something I have to repeatedly say in the work I do. This is not a stepping plan. This is not point one, you do this, point two, you do that. It's not arrows following one way or the other. It's something to use to think about the complexity of it all. It kind of breaks it down into some form of bite-sized pieces that you can move around and think about in more depth. The definitions have been given today, but what this does say is that regardless of what's going on at the micro level, that interface between a healthcare provider and a service user, there is a macro context. And Joanne luckily mentioned about influence, and that macro context is influencing the way healthcare is practiced in society. Now, 50 years ago, 100 years ago, and 50 years from now. So we do have to pay some attention to that, and they've conveniently been named as four main elements of the macro context that we need to look at and think about. And one of those was strategic leadership. Now, whilst I've been doing a lot of work around leadership, and it was my own PhD thesis back in the day, strategic leadership was not my specialty, So this was a high challenge for me today to talk about this and think about person-centeredness from this macro context. So what I'm going to do is actually offer you some kind of theoretical proposition and some provoking questions at the end, which I'm really hoping Joanne will be able to answer, and that most of you in the room will also be able to answer as well. I don't want to be talking for half an hour, I want to be talking for max quarter of an hour. So I do feel I need to position myself first. And when I'm talking about person-centeredness, person-centeredness is one of those words that is talking about a quality. So what is that quality then? It's around centralizing and valuing personhood. Not the individual, it's centralizing and valuing personhood. That's what matters to a person. That's what makes someone who they are, as Chris eloquently demonstrated in his reflective account earlier, whilst relating with them. In doing so, our thinking and our doing in relation with them is based on mutual respect, and together we can co-create a positive environment where everyone can come into their own. Now, this was a definition I've done with a very dear colleague of mine, Funke from Litauen. I think she's in the room, and we had the great privilege of the School of McCormack and McCants for many years during our PhD study. So we do feel as if we've got to know the thinking behind this reasonably well. I'm not going to spend time on this. This is the 2017 definition that's used an awful lot. What I will do is emphasize approach to healthcare practice in fostering of healthful relationships. A healthy relationship is a really nice concept, and I know Mariah McKay has looked at that as well, and I'll refer into that later. The underlying values, and we've talked about them early stage: respect for persons, individual right to self-determination, and there's a mutual respect and understanding. And that's something in the Netherlands we've really tried to push. It needs to be mutual. You need to have reciprocity. Person-centeredness is not a one-way street. If it is, you should be asking questions about whether it's really person-centeredness that's taking place. So person-centered practice, something you exercise, is the continuous co-shaping of relationships and structures within, and then it's not restricted to healthcare practice, in care, learning and working environments in such a way that self-direction and dignity of all involved are achieved. So we can then take the person-centeredness out of the healthcare practice and maybe apply it to other things as well. I remember in the early days I started looking at what's this term being used for, and I saw the term healthcare person-centered architecture, which seemed really interesting. And only now that I'm beginning to understand what that could possibly mean. Leadership for me is also a practice. So if I attach the term person-centered to leadership practice, then I start to get this quality that I'm adding to leadership practice. Leadership for me as a practice is relational, and it's intentionally influencing others to realize, hopefully, shared goals. Not always shared goals, but hopefully shared goals. And Joanne was quite eloquent in doing that. And then I come into the word of strategic leadership. New to me, but a little bit of reading helped me understand it more precisely. Timely and continuously planning and enabling an envisioned future across systems. And I think Joanne's talk just now really brings that to life to me. I could see all of this from what she was talking about.
Auf Information und weitere Betroffenenrechte. Informationen zur Datenverarbeitung PCP-ICoP mit Ihren Rechten können Sie unter www.telefonica.de/Rechtsdatenschutz abrufen.
I think we've got.
Zum Einverständnis möchte Telefonica dieses Gespräch zur Serviceoptimierung aufzeichnen, mitführen und weiterverarbeiten. Sie können Ihr Einverständnis jederzeit bei unseren Mitarbeitern mitwirken.
Yeah, great, thank you. I couldn't understand it anyway, so I couldn't really join in the conversation. I couldn't be person-centered stuff, something the other side of that piece of work, whatever they're doing. Now we're coming into person-centered leadership, and I would say it's something that's embodied, it's something that we enact. It's relational, in relationships, and it is contextual. We're embedded. And Christopher did mention Brian Fay's work, so that brings it to life as well. And the valuing then is as a values-based practice is personhood, self-determination, mutual respect and understanding. To illustrate this, I use this diagram as well, especially with students I'm working with, to show the reciprocal influencing which Joanne kind of brought to life as well. I seem to have lost control. Yeah. So if I am in leader modus, if I am leading, then I will be trying to influence the other person, but I also will be influenced by them. You have an action, you have a reaction. So they will be influencing me as well. It's not a one-way street. Together, we will not only be influencing each other, we will be influencing others around us. So we're starting to create a we. And then the we, if we think about a we as a group, we as a community, we as a team, are embedded in context as well. So the influencing from context is not just to me or to you, it's also to us. But what we are doing, and the same as what we are doing as a community of practice, can potentially influence the context around us. So we don't have to be subject to that influence. We can also be actor in that influencing process. So that person-centered leadership is around enabling associates and your own coming into own. And coming into own was one of those phrases the leaders I worked with, they used, as Dutch likes to translate it into English, and it was quite specific in their meaning. I was working towards a shared vision, common goal, which makes it then very complex with all these arrows flying all over the place. And it's continuously responding to and exercising influence and to initiate movement. That's what we're action orientated. We want something to happen. So we're initiating movement and change within self, other, and context. So what's the focus? Is coming into own. Well, when I started to unpick that coming into own, the leaders in clinical practice that I was working with, they were talking around self-actualization. So wanting to be and trying to be and being the best you can be, the best of yourself, which is very rewarding if you think about it. It's about empowerment. And when I started looking at the concept of empowerment in leadership, it was both structural empowerment and psychological empowerment. And I've got quite a bit of critique on how empowerment is talked about in the leadership literature. It's often talked about as being, you give empowerment. Well, you don't give empowerment. You can only facilitate empowerment, because if you give it, you can just as well take it away. So you have to create structures that enable people to exercise more self-determination, more professional autonomy. And that also requires, and that's nice from Claudia's work, talking around that self-efficacy, the belief that they can, so that they will be able to move into an action modus, and therefore experience well-being at work. Because the assumption underneath this is when people come into their own at work, they will have improved performance and commitment. Sometimes they say commitment to follow. I would just say commitment to giving the best service they can. So we come back then to this creation of healthful cultures, which is the ultimate aim of person-centered practice. And by doing person-centered leadership, you contribute towards that. And it's an energy giving for the benefit and health and well-being of all. And as Mariah said, it's about being in practice together and supporting to reach potential. And she did that in an educational context. Now, these are some of the relational processes that you will be using as a leader. You'll be sensing what's going on around you, using all of your senses. But it's important to verify your interpretation. Verify them with various sources of knowledge. You will be balancing needs of those of yourself and of others, and you will be contextualizing. You will be seeing the other person as somebody embedded in multiple life worlds with multiple social roles, all of which will be influencing their current state of being. So it's seeing them as a whole person. It's about presencing, and presencing in terms of being there with the other person and thinking with rather than for the other person, because you are respecting their self-determination. It's about communing. It's not just a dialogue, it's also action-orientated dialogue, because you want movement. That's what your aim is as a leader. And all that information you're getting from relating in those ways, you're going to be using to, how am I going to position myself in regards to the other person I'm trying to lead? So am I going to be leading from the front, the sideline, alongside, or behind? And we see similarities with Hershey and Blanchard's work in this work. But in person-centered approach, it's about offering to role model, not role modeling, not imposing the role modeling, but offering, respecting self-determination. Offering instruction from the sideline, or coming along more closely and working more closely and offering high challenge and high support to help someone move into action mode. Or sometimes stepping back, letting them learn in practice, experiential learning, but still being there, because if and when need be, you can move into a different position. This takes place in context, and there were several things in the context influencing the way the leaders were leading. There were the community spaces and learning spaces that they created and facilitated, and also what happened in those spaces, whether they facilitated them or not, was starting to influence their leadership relationship. So there was a mutual influencing there as well. The needs and interests of others was also a contextual factor that influenced leadership and the outcomes of the leadership, and particularly the medical team, who weren't interested in being part of nursing research at that moment in time until the nurses started to, move forward, and their power relationships changed, and then they become very active as well. And of course, evaluation systems will be giving input to the way they are leading as well. So in short, it's relational. When it's really practiced really well, you don't know who's leading who. So which of these men is leading the other man? That's why it's two men and not a man and a woman in the traditional sense of the word. It's contextual. Try and dance an Argentine tango on a beach. You've got an ebb and a flood that's going to be causing shifting sand. You've got weather conditions in the Northern Hemisphere at this moment in time not as conducive to good dance as the Southern Hemisphere at the moment in time. You're going to have to be working with those, and working with those is going to affect the way you dance. So it's complex and dynamic with this multifocal and multiple ways of influence and multiple influencing. So key questions: be sure what you're leading, who you're leading, where you want to lead them towards, why you and why there, and how can you best lead. So we come to the strategic level. Strategic leaders are usually those CEOs, such as Joanne, that lead across a system. But it also be a consultant nurse. It could also be a professor working at a national, international, global level. So there are lots of strategic leaders leading in systems. And they're doing lots of this type of stuff. They're monitoring culture, contextual changes, trends. They're directing change. They're unifying groups. They're doing human resource management as well, because they've often got a team with them. They're role modeling, and they're engaging with very different and very complex stakeholders as well. So basically, what the main thing they're trying to do, and Joanne articulates it well, is envisioning a new context, a new future. Where do we want to go towards? So then they can start transforming to go towards there. And they will need to be political, because they'll need to take different needs, different stakeholder needs, and work with those. It may not be party politics, but it certainly will be political in what they're doing. So I lost control again. They will be managing certain processes and structures, and they will be ethicizing as well. This is not my thing. This has come out of the literature, the descriptions of strategic leadership. The most successful will be authentic. That's what does come out of the literature when we're talking about this. And my proposition would be, in leading person-centered healthcare practice, that authentic leadership would need to be person-centered leadership. Because the authentic leadership is about being true to your values. So you would need to understand person-centeredness, what it means in a leadership relationship, so that it then can start envisioning, transforming, ethicizing, managing, and politicizing to create the person-centered practice. So that's it. Have I got time? I'm a bit late. Key questions for the strategic leaders in the room. Sorry, Joanne, I'm going to name you again. What could the person-centered leadership framework offer you as you lead across systems, and what's missing? And for the others who do not consider themselves strategic leaders, but will be associates of, what differences do you observe between those strategic leaders that you know and you consider to be person-centered and those you don't? What makes them different? And could you invite or enable some strategic leaders who you may not consider person-centered to become more person-centered? And those are the questions for you to contemplate and refer to. I'll shut up now.
Okay, Shaun has set this challenge. Who wants to answer?
Do you want me to start? What's missing? About 40 years is missing. Oh my gosh. In the UK, we have got some way to go, but I do believe that some of the new early career nurse leaders are in this space naturally. There are some of us that thought we were in it, but probably weren't, but we're not sure. But I'm happy to put my hands up. But there are some people in strategic leadership positions that just do not have any ability to look inside themselves and ask whether they are in it or not. They just wouldn't even want to be part of this conversation. Believe me, I've tried for 4 years. So I think we've got, what's missing is, I think we need more of me to get together with some associates to start talking about this really seriously and writing about it and offering leadership programs, offering, you know, something as deep as a residential school for our, you know, we should really be offering this to our chief nursing officers for the country. Not, you know, really
my question was, what I presented, those 5 leadership practices, basically: visionary leadership, ethical leadership, transformational leadership, plus the person-centeredness leadership in the middle. Is that enough, or is there something missing? So those strategic leaders that are there, is this enough for them to be effective in creating person-centered healthcare cultures, or is there something missing?
I still think what's missing is what I've had to learn over the last few years. And what's missing is that I believe, and this is my belief, and it seems, I probably will just seem as if I'm tarring everybody with the same brush, which I'm not, but it feels to me as if our executive level nursing leaders, just in nursing, a lot of them have lost their identity as a nurse. They are executive leaders in an executive boardroom, displaying executive behaviors that probably are not aligned to this. So there is, I think what's missing is a conversation about our identity as person-centered leaders, but as our profession, you know, within a profession, medicine, doesn't matter, whatever. But I think the higher up you go, you lose the core of your being. You lose your reason why. And I've just about got mine back in my mid-50s. So there is I think there is something missing there, but it's not unachievable. You know, we've just got to marry it up and talk about it.
I don't have a hand gesture, but can I jump in? Is that be all right? Can I just jump in here? Thank you, Shaun. You know, we go back a long way, and I remember a lot of your work kind of going back onto Joanne. And I think what you've hit on the nail on the head here is, first of all, I'll just kind of refer to what Tanya was talking about earlier and what Joanne was talking about, is that if you don't get it, you don't get it, and you don't. So that essentially is, you're talking in a vacuum if you don't really have an embedded understanding of what person-centeredness really is. And we are the lucky people who maybe have kind of drilled that down and taken the time to have that understanding. And I kind of look in many ways, and I know that you're talking about strategic leadership at a high level, kind of in the macro context, but if it isn't being driven kind of, and I work in a small organization, but it is about being consistent and persistent in using the language, the actions, the perception, and using your influence to get it into policy, into practice, into everything that we do every day, is a start to be able to influence. Now, in my organization, we had a change of kind of, let's say, leadership at strategic level, and it's like starting back at the beginning again in trying to bring that deep embedded understanding to the higher level who think they know, but they don't know. So I don't know how we can, and certainly, absolutely, I would say, is strategic level understanding. I think you're spot on, Joanne, to be able to get the strategic leaders. I'm in Ireland. I'd love to see strategic leaders really having that embedded understanding. I'm sure Margaret Codd would be with me on this, but they don't have the time, and they think they know already. So it's getting that to that level. Yes, I think wonderful if we can bring them all to a facilitation school, but they're not going to be there because they'll be on the phone. You know?
I think my answer would be maybe thinking about if a strategic leader, someone I consider to be a strategic leader, says we need person-centered healthcare, I would say, well, how are you role modeling that the way you are leading your team, not the organization, the way you are leading your team in relationship with your team. Are you treating them as, are you valuing personhood in the way you relate with your team members, your management team, or wherever you are closely leading, to then start to trigger them to think about, well, what does person-centeredness as a quality mean? And then to move on into their own leadership practice before they start thinking about, okay, well, are all these structures and documents and frameworks that need to be implemented in the organization? So maybe that is something to think about.
If you don't mind, if I just jump in on that one, Shaun, and I think that's a great idea. But if you talk to somebody in a senior level, they will kind of, when you're talking about, you know, what do you want? What does person-centeredness mean to you? They believe that they know. They believe that they already have that knowledge, and that they believe that that is everything that they do all of the time. And because, let's say, a lot of the work is unseen on the ground, and because it's situational and embedded within a culture, people can't even describe it. And it's just that complexity of the language that we use and how we can bring that understanding to all levels. I'm not saying we should and will continue to try to bring it to that level, but in my experiences, a lot of the people that I need to influence already believe that they know.
Can I maybe just come in on the back of that? And I see there's 2 other hands up, so we want to leave room. I feel I couldn't let a whole webinar go by without highlighting what I believe we're talking about here. These senior, everybody who is on their journey, it's a journey with self. I couldn't let it go by without acknowledging the importance, and why it is so complex is because a key component of this is about knowing self and our journey with self, and how critical reflection helps us along that journey. And some people, I think it was already said, some people won't go there, don't understand they have to go there, think they're already there. So I think that is a massive part of the complexity. And it's what I said earlier on. If you think about our modes of being, we all understand our way of operating the world differently according to the kind of person we are, the journey we've been on, the work, the self-work each of us have done professionally, personally, I would imagine also. So that is where the level of complexity comes. And I'm sure Margaret has her hand up, and I'm sure Chris is going to say something maybe on the back of that too.
And just to react, one of the leader attributes in the person-centered leadership framework is reflexivity with an X. So it's thinking about what the situations you're involved in and what your contribution to that situation is. And that's the incorporation of this self-awareness is built into the framework as well. But I don't want to take your...
So I think with Claudia, I think with 2 other hands, I'm going to leave it in your good hands to bring them in, each of them.
Chris, please. You're in mute, Chris. Turn your micro on, please.
Yeah, in the paper I gave, I showed the vision for the hospital, which used the words person-centered practice. It does make you wonder who wrote that vision, because you'd imagine that the executive board itself would write that vision and actually use those words themselves, person-centered practice. So it just exposes the enormous contradiction between what goes on at the strategic board level, if they indeed wrote those words, and what goes on in practice, this huge mismatch. And Shaun noted Brian Fay again with critical reflection. And you have to understand the nature of the transactional organization, that it's a particular paradigm. When you talk about transformational, or I use the word servant leadership paradigm, you think, well, rationally, it's easy to move from one to the other to support person-centered practice. But as Fay demonstrated, that the barriers of embodiment, tradition, and power authority are huge, absolutely monstrous. and that there is no chance of rational change, and hence going back to this idea of the critical reflection is the only way in, really, for as far as I can see. But I'm going to lower my hand now. So thank you.
Thank you. Margaret?
Well, you had to take your microphone off.
Yeah, I was trying desperately there. It's off now. So I think I completely get the piece about a huge part, all of person-centeredness is about knowing self. And where am I in this situation? What am I contributing to this situation? I completely understand that. But there are so many elements to it, and it is so complex. And the gap between the espoused and the practice is so enormous. And there are many places that have a charter on the wall that espouse all of these things, but the reality is so different. And Joanne, I loved one of the things that you talked about in the example you gave, and it was a fabulous example. And it was about firming the message. And if there's ambiguity about the message, or if there's any confusion about it, or in terms of its language or its message, and a big part for you at the beginning of your journey was firming the message and getting your one pager so that you knew exactly what to pitch, and then you could avail of the opportunities that arose. You could create opportunities, and you could avail of the opportunities that came up. And for me, that is a huge thing, because I find it hard to pitch person-centeredness consistently in the same way all the time, you know.
Thank you, Margaret.
Thank you.
So can we move forward? Thank you so much, Shaun, for your presentation.